probably one of the earliest things that at least sort of AI was actually used and is actually looking at like biopsies. And so again, it was sort of looking at if you could basically train like a program or the computer to look at all of these digital slide pictures. Could they actually diagnose things like just like a pathologist would. It's really, I mean, it is promising. It's definitely very early days. And so I don't think a pathologist is out of a job. And again, we recognize there's always like limitations. Obviously, AI is also trained by humans, and so we're going to ultimately be involved in that process.
Yeah.
But I think what you bring up, like that. Those are exactly the ideas that people have kind of looked at, and to some extent, again, this is more on like the kind of basic research side of things, but there's some very special fancy stuff that you can do to like tumor specimens that are on a slide where you can essentially look at different cell populations. So there's a cancer cell, but what we know now is that in order for a cancer cell to really kind of blossom and flourish, it needs a really nice home. And we call that the tumor microenvironment. And so, the cancer cell, it wants a lot of blood vessels so that it can get nutrients and blood to it, oxygen. It also wants to make sure that it kind of trains the immune system, if you will, to say, hey, make sure that you don't attack me. And then it needs its little bed, which is kind of like what we call like the stromal tissue or the connective tissue. And so there's been a lot of, just thinking of the application of kind of AI algorithms, if you will, is that there's been some really, really cool work where they've essentially looked at can you recognize each of those different cell populations and then study them, on like a tissue sample, without having to dissect it all out, which is
Yeah.
really, really hard. So I do think that certainly it's probably more pathology based kind of research applications that AI is going to be applied to first.